I think for purposes of this interview, I got to say that I am past president of the International Neuromodulation Society. I am past editor-in-chief and founding editor of our journal, Neuromodulation Technology Neural Interface. I am leading editor of the first textbook on neuromodulation and have been clinically involved in neuromodulation for over 40 years. Neuromodulation is providing either external or internal electrical stimulation of the nervous system or chemical stimulation of the nervous system that basically restitutes abnormal chemical pathology within the nervous system to normal. So clinically, in patients with pain, that may be pain relief. In patients with Parkinson's disease, that may mean a restitution to normal, decreasing of tremor, improvement of motor function, improvement of eyesight, etc. Neuromodulation for many years was really focused on treatment of pain. And then in the late 1980s, a neurosurgeon from France, Alain Benabed, introduced deep brain stimulation for the treatment of Parkinson's disease. And since that time, the indications for clinical electrical stimulation and intrathecal therapies with chemicals for treatment of pain and other diseases just growing exponentially. We now are able to use electrical stimulation for the restitution of eyesight, for impaired hearing, for inflammatory diseases such as rheumatoid arthritis or Crohn's disease or inflammatory bowel disease. We use electrical stimulation to control heart rate or abnormal heart rhythm. So the indications for electrical stimulation have grown. I think that the future of medicine will be neuromodulation for cardiac disease, for cancer, with the advent of a new technique called optogenetics. When we combine optogenetics and neuromodulation, I think that we will see many, many more diseases being treated with neuromodulation. So again, neuromodulation is providing electricity to restitute abnormal pathology to normal. So it's either applied directly through a surgical procedure, but can also be used externally. We can provide external stimulation, as in transmagnetic stimulation of the brain or transcortical stimulation of the brain by placing electrodes on the brain to stimulate for depression or stimulating for anxiety. There is now external vagal nerve stimulation for use for chronic cluster headache or migraine headaches, and in the future will be used to treat asthma or treat rheumatoid arthritis. But for the most part, in patients with chronic disease, presently, most patients undergo a minor surgical procedure for placement of an electrode near a target nervous system. Sure, I think all new therapies, including neuromodulation, requires expertise. Expertise comes with education, comes with practice. So the first question is who performs these, what kinds of physicians perform neuromodulation therapies? I think that answer is tied to the answer of how many diseases in the future will be treated with neuromodulation. Presently, for pain, we have neurosurgeons, anesthesiologists, neurologists, and physiatrists, all who do spinal cord stimulation for pain. We have neurosurgeons who do deep brain stimulation for Parkinson's disease, for tremor, for epilepsy, for other disorders in the brain. So we have urologists who do sacral nerve stimulation for bladder disorders or micturition disorders. So I think we have gastroenterologists who are doing stimulation for gastroenterologic disorders such as chronic vomiting or obesity. So I think that each field in medicine will have its practitioner of neuromodulation who will be trained to do neuromodulation techniques. Well, that's a good question for me because I think that I know I got involved in neuromodulation in 1979 when I implanted my first intrathecal catheter for intraspinal infusion of morphine. I was the first anesthesiologist to put in a spinal cord stimulation device, and prior to me doing that, it would be done by a handful of neurosurgeons in the world. Today, we're a society of neurosurgeons and anesthesiologists and urologists and cardiologists and all kinds of gastroenterologists, all kinds of doctors. And I was involved in the beginning, starting the societies. I think that's very important that a society of like-minded physicians is important for the growth of any field, be it cardiologists or neurosurgeons or anesthesiologists, or neurosurgeons and anesthesiologists practicing neuromodulation. So we all got together, and when we started the society, INS, International Neuromodulation Society, we only had 2 members. And I started the journal, and out of the journal grew an interest in our society. Today, the International Neuromodulation Society has over 21 international chapters, of which Argentina is one of our chapters and one of our better chapters, more active. You know, the United States is because of the wealth of that country, I think, has the largest number of people performing neuromodulation techniques. We have about 2,500 members today in the United States. We have well over 5,000 members in our society today. So the question about dissemination of information is very important, all relevant to the scientific, basic science and clinical science of neuromodulation has been our journal. I'm proud to say I started the journal. I was editor-in-chief for 14 years, and now our president editor, Robert Levy, is doing a bang-up job, a very good job, in helping the society grow and disseminating appropriate scientific information. And when I say appropriate, that means it's well peer-reviewed, that there's always a critical eye, that these papers can be better than presented. Our scientific meetings, both in our regional chapters, in our international chapters, and every 2 years, the international meeting brings together clinical scientists, basic scientists, and engineers in our meetings to disseminate this neuromodulation science. The future of neuromodulation is the future of medicine. I think that, you know, in millennia past and in the present, we think of the body as chemical in nature, and that disease is an abnormality of the chemical nature of the body. Well, we really do understand that the body is not only chemical, it's electrochemical. That the electricity within the body, it releases chemicals that produce the normal function of body. When the electricity is abnormal in the body, then there's abnormal chemical release. So we understand that today, and with this understanding, we now can, as I said, we can treat inflammatory diseases like rheumatoid arthritis with electricity. We can treat epilepsy with electricity. We can treat depression, anxiety. We can treat addictions with electricity. We can treat abnormal cardiac rhythm or abnormal heart with electricity. So I think that the future is so bright for our field. And our field is based on technology. And with the advancement in technology comes the ability to use those newer technologies in different ways. I think it all starts with the understanding that our body is not only chemical, it is electrical. So we don't only treat disease with chemistry such as drugs, pills. We treat it now with an electrical pill, restituting abnormal pathology towards normal. So the future is bright. The future is exciting in neuromodulation. And basically that's the answer to that.